Welcome to Morning Infusion with Dr. V. Have you ever wondered what it would be like to be a nurse and leading your personal life and your professional life? Well, stay tuned to our special guest today. My name is Dr. Viola Pierce. I'm the owner and the CEO of VP Nursing and the Nurse Nurturer and the facilitators of Secret Suppers Worldwide with Dr. V, where our goal is to equip healthcare professionals to be financially stable, to lead a full empowered life. Our goal is to come to you each Monday, Wednesday, and Friday at 7:30 a.m. Eastern Standard Time to give you the fuel to crush your goals, to show up exceptional on a daily basis. You can follow us on Twitter at The Nurse Nurturer, Instagram at VP Nursing, and if you are watching on YouTube, don't forget to hit that subscribe button and please share this video. You can also visit us at our website at vpnursing.com. Our special guest today is Dr. Susan Little. She is one of my friends' wives. Okay. So now she's friend by proxy. Dr. Susan Little is a public health nurse leader in North Carolina. Her career has taken her to local, state, national, and international public health practice settings. Susan is married to a nurse practitioner and has 2 lab mixed rescue dogs. Her passion is described as a commitment to excellence in nursing and public health. She draws her energy from mentoring and advocating for public health nursing. So welcome. I'm super excited to have you. So got a few questions for you. So did you decide to become a nurse prior to marriage or post-marriage? And why did you originally want to become a nurse in the first place?
Actually, I was married. I had been married just a short amount of time, and I was working. I had a biology degree from Meredith College in Raleigh, and I was working at an OBGYN in Raleigh, as kind of like the medical office assistant sort of thing, that was my first time I had been exposed on a continual basis to nurses. So I had grown up with a physician father, anesthesiology, so medicine was always in my life. But I hadn't been exposed to nurses long term, and I would watch them every day, and I started thinking, I think I could do something like that, go back to school. And so we actually moved about a year later and ended up in Wilmington, and I started finishing up the few prerequisites that I needed, and then went back to school down there.
Sweet. I love it.
UW. Mm-hmm.
I love it. Now, you and your husband became nurses. Now, you mentioned that you both wanted to go to school at the same time. How did you decide which one would go? Y'all flip a coin?
It was close to flipping a coin. So you're exactly right. We both wanted to go back to school. We moved down to Wilmington. Bill had been a medic in the Army. And we were both, when I went down there, I was working as a phlebotomist in the hospital. When we moved down there, I was working as a phlebotomist in the hospital, and he was working in construction. And we were both, while we enjoyed our jobs, we knew that that's not where we wanted to land for the rest of our lives. And I again had been wanting to go back to school, and he had also had mentioned that he wanted to go back to nursing school, and we're like, well, we're not rich, so we can't go back to school at the same time. So how are we going to figure this out? So we actually used a decision-making tool that we've used throughout our 30 plus years together, and that is rock, paper, scissors. And I won, and he always says I always win and I cheat, but I did win. I went back to school, and eventually Bill went back to school and became a nurse, and then became a nurse practitioner as well. This is where he knows you.
That's right. That is hilarious. Like, I was like getting ready to ask you about this scientific method, this decision tool that you talk about some rock, paper, scissors. I love it. So tell me about your relationship with your husband. I hear that he is super supportive. How important is that as it relates to your profession and in life itself?
He is super supportive. I'm telling you, he's been super supportive from the very beginning. While we first got married, probably within 2 or 3 months, I said, Bill, I want to go to Outward Bound. I don't know if you know what Outward Bound is. It's a thing that usually high school and college age kids go to, where they go and they spend a month or 5 weeks in the woods and they find themselves or whatever. And I just wanted to go spend some time in the woods. And he's like, go for it. And he went on and moved to Wilmington. We were living in Raleigh at the time, and I went up to the mountains and spent a month in the bush in the mountains. And his support of me has been like that forever. Another good example is when I was in nursing school, the 2 semesters between nursing school, most of the folks would do internships at the hospital. I had already been working in the hospital for several years, and I thought I knew where I wanted to work, and I already had a rapport with them, and they were wanting me to come work with them and everything. I said, well, I want to do something fun. So I want to go to Africa, or I want to go to South America. And he's like, go for it. So I ended up spending the summer between my 2 years of nursing school in Zambia, Africa. And, and then, he's just been like that all the time. He's always lived his own life like that, where, there's nothing stopping him. And that's how his support for me has been. And we're lucky enough to get along very well. Granted, we have our issues. We definitely have our issues. Everybody have your issues. You can't put
That's
two
right.
people in a small house for 30 years and expect them to be perfect all the time.
That's right.
We are very good, and we're very appreciative of each other. And yeah, he's wonderful. He's very respectful of me and my time right now, especially with COVID, where I am working so many hours, so many hours. And being at home allows me to save a lot of time, so I can actually spend time with him instead of, the 13, 15 hours a week where I'm putting my makeup and driving to Raleigh and driving back home. I don't have to do that. So I can spend a little bit more time with him, even though I'm doing a lot of extra time, extra work. But he got used to that when I went back to get my doctorate at Duke University, because I was working full time and I was doing that for about 20 or 30 or more
Right.
hours a week. So he's used to that, but he's also very respectful and he gets it. Thank the Lord he's a nurse, because he really gets it.
Yeah, it's very important, I think, for to have. I think that some people, or maybe some men, or maybe some women, it depends on how they feel about their spouses and not being supportive. And what they don't understand is that support is super important, especially in nursing and especially during this time, right? And so, my husband has been super supportive, and that has helped me. Like yesterday, I came home, I walked in the house, I kissed him, I said, I've got a coaching call. I went upstairs and I was up here until, 8 o'clock. And then I went back downstairs, and his support, just knowing, he's like, well, I know you're in the house. I know we're good. So we're fine. That support is good. And like you said, we don't go without, issues, right? But it is super important that that support is there. So I love that. I love that. You make me want to love him even more, if I could love your husband. Now, why did you choose public health as a path?
Oh, so remember I was saying that I pretty much thought I knew where I wanted to go work, because I've been working in the hospital. And so when I was in nursing school and it came to the time where I was going to do a clinical in that critical care unit, I knew everybody. I went in, I expected it to be a breeze and all would go well, because I knew I was going to work there one day. And it was just this horrible experience. I ended up in tears every day. It was horrible. It was the most, it just clearly it changed my life forever. So I was pretty distraught after that, because I didn't I didn't know where to go. I had no compass.
Right.
And I remember there was a girl in nursing school with me, and she's like, I know exactly what I want to do. And she wanted to go and work in a doc in the box afterwards. That was her goal.
Okay.
And I thought, oh, I need to find my compass again. And thankfully, I had a friend, or Bill introduced me to her, that he met when he was traveling around the world, who started the hospice in Nairobi, Kenya. And I thought, wow, I want to do something cool like that. Um, the summer between my two nursing school years. So having that opportunity to go and live in Zambia, that I told you about, Zambia, Africa, for the summer between the two nursing schools, and not having a compass actually came at about the same time. And that's when I realized what I wanted to do. When I was in Zambia, I fell in love with what was going on at this hospital. It was the Salvation Army out in the middle of the bush of Zambia. And but it was the coolest thing I'd ever experienced. No, I'd never seen anything like this in the United States. They had the hospital, but right next to the hospital was this area where they would teach people how to do sustainable farming so that they would be able to grow their own food. Another place right beside the hospital is where they taught people how to build the adobe bricks so that they would not be living in thatched houses, but would live in adobe brick huts instead of houses, because they all cooked with outdoor or indoor open fires. And that was the number one way they would lose their houses, is that a spark would hit the thatched hut and it would burn down. And there was also a lot of people burnt and victims of burning. They had the equivalent of WIC. They had a place where they would teach about women and infants about and their infants about prenatal and postnatal nutrition and infant nutrition. They had a home visiting program where they went out and they home visited, and this was back in the mid-90s. They did home visits to people with HIV. They did home visits to pregnant women. They had a housing place right beside their hospital as well, where high-risk pregnant women would come and live there their last few months, so that they wouldn't have that. They would be near a hospital instead of out in the bush wherever they were living, far away. No transportation, and for the high-risk pregnancies. And then they also had, on another part, they had the housing for folks who had chronic diseases. And so they very highly infectious chronic diseases, and so that have been ousted from their families. So they had and communities. So this was a place that those folks could live safely and have their community. And I thought, I've got to figure out, there's got to be something like this back at home. I don't know what it is. I came home, I said, what is this? I know it's called public health. The only thing I experienced was sitting in a room with a immunization nurse giving immunizations all day at the local public health department, and I couldn't do anything but watch because I hadn't been checked off yet. And I thought, what is this? And so I started volunteering, and I got embedded in public health, and I would have my first public health job within about 3.5 months after I graduated from nursing school.
I love it. I love it. I love that timing. God knows how to put us in the right path in the right time. I love that. Love that. So now I was going to ask you about your unconventional route, but you just told us the way that you took that unconventional route to get to where you were. I love that. Now, can you name a person who has had a tremendous impact on you as a leader? Maybe someone that has been a mentor to you, and tell me why they were.
Yes. So I've been lucky enough to have a lot of mentors later in my career. In the last 10 years, the one that immediately comes to mind is Dr. Joy Reid. She was the chief public health nurse for North Carolina for many, many years, and was very involved in practice leadership, as far as being involved in North Carolina Nurses Association and a bunch of national nursing associations, as well as American Public Health Association. And after I left my job, a job that I had at a local health department, I was working at the state in Medicaid, and I wanted to move over back into public health because I missed public health. And although Medicaid absolutely is a public health program, an essential, a very important one, I need to have the local health department kind of world in my life. And so I was interviewing for 2 jobs and was the top candidate for both. And I decided to go with the one where Joy Reid was hiring me. And let me tell you how I made that decision. And I'll tell you why she's an important mentor to me. So I was trying to decide which one I wanted to go to. And I looked at the 2 jobs, and I did this kind of forward, backward decision-making model, for lack of a better word, a way of describing it, where I looked at myself, where would I be in 10 years? And what would I like to look back and see? And that helped me decide that I want to go work in the chief public health nurse's office. And that was Joy Reid, who hired me. And within a year or so, after I saw her and all the work that she was doing at the state and national level, that she was modeling for me, I thought, wow, I'd like to get involved in this. And so I got the opportunity to apply for something. And I applied. I said, Joy, I'd really like to do this. And she said, go for it. And from then on, this mentoring relationship just kind of bloomed out of it. And I always kind of think about, because I'm very involved at the national level in public health, in nursing and public health practice, and policy and competency and practice areas. And I always think about her, and I've done it in honor of her, because if I didn't see how she modeled the kind of behavior that looked interesting to me, and then the support that she gave me, I would not be where I am now. And she saw in me something that I had not recognized in myself. And she made that very clear to me in 2014 when she retired. And she said, and I was one of her regional nurse consultants, and she said to me in a letter, after she retired, she said, and I still have it, it's framed, it's at work. And she said, Susan, you know, wonderful things about me being a part of the team and things like that. And the last thing she wrote on the letter was, and one day I want to see you in my old job. I still get chills now. I never thought of myself as someone who would rise to the chief public health nurse for the state of North Carolina, the chief nursing officer for the Division of Public Health.
Wow.
It changed my mind. It blew my mind and changed my world. And I have done everything since then. I've done to move myself towards that, and eventually now that's where I am in my career.
I love it. I love it, because she spoke that into your life. You know what I'm saying? She spoke it into your life. That is, that is what we as nurses should be doing, right? Because, as nurses in the past, and I don't know how bad it is now, but in the past, it is, the nurses kind of eat their young, right? Yeah. And you want to be able to mentor that person, that next person coming up, instead of eating your young because you're afraid that they may get your position or whatever. I mean, eventually you got to come out of that position yourself, right? But she spoke that into your life, and I just cannot tell you. That warms my heart. I already like her. We need to meet. We need to meet. So now, how do you encourage creative thinking within your organization?
Well, I've been thinking about this question, because I knew you might ask that to me, and here's where I landed. And all you nurse geeks out there will really appreciate this. But it comes back to the nursing process, because here's why. Nurse geek, here's why. Okay. Anybody can be creative, But if you
Uh-huh.
want to be creative in your professional field, it has to be, you have to do it with almost like a intentionally be creative. Because the ideas that you come up with have to be based in reality. So you have to do your assessment, right? You've got to find out what is the need, what is the problem, what are the gaps, what is going on. And then once you have identified or diagnosed that problem, then you come up with a plan. And that once you know exactly what the problem is, you can be so creative. Otherwise, your creativity may be misfiring and may not be actually reaching or addressing the problem that you thought you had. So it's all about the nursing process and going through assessment, diagnosis, planning, then of course you implement and evaluate it.
That's
So
right.
that's where I think it is. And as far as how I support creative thinking, and with the nurses that I work with and with the non-nurses, because the nursing process is closely related to the Plan, Do, Study, Act quality improvement model. You know, you plan it, you do it, you study, you see if it worked, and you act on it. See if it will work, and then you act on it, and then you go through the process again. So it's the nursing process works well in concert or in partnership with these other non-nursing frameworks that help you solve a problem by in creative ways that you can be more assured that it's actually solving the problem that is the problem, not the problem you think it is.
That's right. That's right. That's right. Now, yeah, you are a nurse geek. I love it. I love it. So now, what is one characteristic that you believe every leader should possess?
Oh, yeah. So as much as possible, get out of the way of your subordinates and your colleagues. Get out of the way. There are times when you have to do checks and balances. Granted, that's why if you're in a leadership role, you have to, that's why you're in the leadership role. There are certain checks and balances, but just get out of their way. We don't know everything. Your group should, as a whole, have a wide enough or different variety enough of DNA in your group that together you all can be the greatest. But one person can't do it. So identify that in yourself, and then identify a person near you, either a subordinate or a colleague, or even maybe someone above you who has that, and then get out of their way and let them fix it.
That's right. That's right. I love that. I love that. Now, what are some of the few of the resources that you recommend to someone looking to gain insight into becoming a better leader?
Okay. So I have this kind of internal vision that I carry with me that I've spent time putting together over the last few years that has worked well, and I talk about it a lot. And I'm still putting words around it, but I think I'm going to call it my Tommy Bahama backpack chair philosophy. So here's what the Tommy Bahama backpack chair philosophy is.
I'm interested in hearing this.
So we cannot wait to be asked to come to the table, especially nurses. We have so much unique, specialized information and experience and knowledge that we must share. It's got to be part of the larger conversation. And if we wait for someone to invite us to the table, we'll never get invited. So what we do is we get one of those beach chairs that has the straps on it.
Mm-hmm.
Metaphorically, put it right on our back and carry it with us all the time. Open that door, go to the table. There's not an open chair. Say, excuse me, and put your Tommy Bahama chair on the floor and start bringing your own chair to the table. It's so important because we all feel as if we can't, so many of us feel as if we don't have a voice, and we do. We just have to figure out how is the best way to 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 have that voice be heard. But it may be before that to use that voice and
Mm-hmm.
then have that voice be heard. So the Tommy Bahama Backpack Chair Leadership Model by Susan Little.
I love it. I love it. One of the things that I think about when you say that is I think about the magnet model, where you have, that that shared governance, right? You
Mhm.
have those bedside nurses that are coming to the table, because the reality is that I can I can think that I know, like you said, what the solution is all the time, but bringing people to the table who really do the work, right, is invaluable. It is really, really invaluable. And so I love that backpack. You
Yeah,
just go
it's
ahead.
another thing. You'll see a hashtag. I'm on Twitter occasionally and Facebook a little bit more often, but I use this hashtag mostly when I'm talking about nurses and their voices. Nothing about us without us, or nothing about them without them. We can't make decisions about patients or groups of nurses or community members without their voice. And we also need to make sure our voice is in that conversation as well.
That's right. That's right. That is so, so true. So now what are some of the things that you're doing to ensure you're growing as a leader?
Oh, I surround myself by people that intimidate me. And I hate that word intimidating because they do nothing. None of their actions are intimidating. It's a feeling. So they are wise and powerful and well spoken and intelligent and in ways that I don't feel I am. And so I find ways to surround myself with them, either by volunteering to work on a project or taking leadership of a project and making sure those folks are on the team. That's what I do.
Yeah.
That's how I continually grow. And I probably volunteer a little bit too much if you ask Bill, but it gives me a lot of joy. And my volunteering is all in nursing, mostly at the national level.
And one of the things that is very true, because when I remember I was going really hard, this is when I was in my doctoral program, and I remember one of my very special friends, Miss Minnie Dickens. Miss Minnie Dickens said to me, she said, you're doing too much. She said, I want you to, why did you do that? And I said, everything that I do is intentional. Everything. There is not a thing that I do that is not intentionally going to lead us to an end result. I said
Mhm.
the reason why I'm volunteering at this specific, like I will volunteer at summits. The reason why I'm volunteering at the summit is so that I can understand how to better lead, how to better deliver content, how to be a better person. Intentionality is huge.
Mhm.
And I always say that, you don't need to be the smartest person in the room. If you're the smartest
Mhm.
person in the room, you're in the wrong room.
Exactly. You don't have the right people around you.
That's
Invite
right.
other people. Yeah.
That's
Yeah.
right. That's right. I was just saying that just last night. I said, you have to be very intentional about who you surround yourself with, because you're the sum total of the five people that you hang out with the most, period. Don't blame the story. And so I'm very intentional about that. So it has been such a pleasure. Such a pleasure having you. I'm glad that I met your husband years
And
ago with his crazy self running 100 miles. He is hilarious to me.
yeah,
So thank
intention.
do what now?
To talk about intention.
I know. Seriously. So my name is Dr. Viola Pierce, owner and CEO of VP Nursing and the Nurse Nurturer and the facilitators of Secret Suppers Worldwide with Dr. V, where our goal is to equip healthcare professionals to be financially stable, to lead a full empowered life. Our goal is to come to you each Monday, Wednesday, and Friday at 7:30 a.m. Eastern Standard Time to give you the fuel to crush your goal. You can follow us on Twitter, The Nurse Nurturer, Instagram at VP Nursing. If you are watching on YouTube, don't forget to hit the subscribe button and share this video. You can also visit us at our website at vpnursing.com. You guys have a phenomenal day.